Hi, my name is Dr. Sheila Dobee from Your Caring Dentist. And I wanted to reach out to my patients and my friends and family because I wanted to let you know that you are all eating a lot more sugar and candy and chocolate because it's a difficult time. And I do understand that, but we kind of have to come up with a game plan. Getting a lot of patients calling up with broken teeth, with cavities and toothaches. So just wanted to do this video just kind of to guide you through how to safely get through this COVID era. And hopefully you'll pick up some other tips and techniques for the rest of your life. So let's get started. Number one, I need you guys to cut the sugar out as much as possible because not only is sugar really bad for your teeth, what happens is the bacteria in your mouth, we all have a lot of healthy bacteria. That bacteria eats the sugar that you're ingesting, converts into acid, and that acid actually eats your teeth. Now that's not good news because then your teeth get eaten, then you get bigger holes that lead to root canals that aren't the greatest thing to do because you have to come in for a dental appointment, which you don't want to be doing right now. And then you end up needing a crown after that. So let's try and prevent cavities. And the way to do that is number one, cutting as much of the sugar load as possible. Now, how do we know what has sugar in it? The easiest thing to do is to look at the food label. And if it says sugar in it, then look at the grams amount of sugar, and that's how much sugar in there. Now, whatever number is on that label, if you divide that by 4, that tells you how many teaspoons of sugar you're actually having. So you'll be surprised how much sugar is actually out there in your food. A can of soda, for example, can have like 14 teaspoons of sugar in there, if not more. And there is so much sugar everywhere. It's in chocolate. It's something that you probably didn't realize is how much sugar is actually in your normal food. Highly processed foods, it's a $2 trillion industry. So what that means is this is a very lucrative industry, the sugar industry, in the sense of in highly processed food, a lot of it that has sugar in it, and it makes it so tempting for you to want to eat sugar. Because it's the way the ads are made, the way that subconsciously it's just everywhere, how great the stuff tastes, the way it looks, it's colorful. I mean, things are blue and pink and green and nothing it looks natural about it. And there's all these funky numbers on the ingredients, E numbers and all this stuff just to make your food look good. But a lot of these foods have a very high sugar content. And sugar is not only something that we need to talk about right now, it's very important health-wise because sugar is causing obesity, it's causing diabetes, it's causing heart issues. And these are the things that if a patient does get coronavirus and they're COVID patients, these are high-risk patients and these are the patients that are dying from COVID. So it's really important that let's make a decision. Let's do it right now. Like right now, let's make a decision to get healthy. Because if we get healthy, that means your chances of having any issues with COVID, if you do get it, you're decreasing it. So this is a great time to invest in your health. And there's so many ways of doing that. So number one is getting that sugar level down. It is so hard to give up sugar. How do I know that? I know that because I did it. I did it about 1.5 to 2 years ago, and it was the best thing I ever did. Once I got rid of sugar, I felt a lot better. I lost like 20 something odd pounds in weight. I got blank out, like my brain was suddenly like revived. I had clarity. I mean, it was just really worth doing. So I can't emphasize how important that is, but it's just probably one of the greatest things that you'll do is if you give up sugar. By the way, it is really hard to give up sugar because sugar is 8 times more addicting than cocaine. And how do we know that? They did some studies. They put these mice in a cage and then they gave them the option of cocaine and sugar, and these mice would rather go for sugar. So when you do have sugar, what it does is it lights up this beautiful thing in your brain and it makes you feel so great and wonderful and happy. So it gives you that buzz and then it decreases and then you're now addicted to sugar. So obviously sugar is very addictive and it's hard to kind of get rid of. So let's, for right now, because I know time is, it's a difficult time, let's work on just reducing that sugar. So if you're like having 2 teaspoons of sugar in a cup of coffee, just try 1.5, then go down to 1. It takes 2 weeks for your brain to actually kind of get used to having no sugar. So let's say you decided you're going to eliminate sugar and you did that for 2 weeks. After that, your brain would be used to you not having sugar, and you wouldn't have those cravings. And this all comes firsthand. I know that worked for me. Like now you can throw a nice ice cream and some chocolate at me and I'm like, yeah, I'm okay. Now the old Sheila, Dr. Dobee, would have been like, oh my gosh, I can't. I used to have a piece of sweet chocolate or something sweet every single day of my life. And I did this for years and years and years because I kind of craved it. I'd eat dinner and then I'm like, okay, I need something sweet. Now, if I have a craving now, I'll just have a medjool date and that kind of cuts the craving. I'll eat a little bit of fruit. And that's also because your taste buds can actually change after, again, 2 weeks. You get a whole bunch of new taste buds and you get used to eating these new foods, which is strange because I never thought I would like broccoli, by the way, and broccoli and Brussels sprouts. And now I'm like, hey, this stuff tastes good. And I'm like, oh my gosh, I don't even recognize myself anymore. But it does work, which is crazy. But anyway, back to the sugar. Sugar is also really bad for children. It actually can cause sort of damaging to parts of the brain. Like they did a study where they found that a child that eats sugar, it can actually damage the part of their brain that deals with empathy. So when these kids get older, they're less empathetic. So we really need to kind of understand this more so that we're not damaging children's brains. We're not damaging our own health from eating sugar, getting obese, having more issues with diabetes and heart attacks, and being more prone to things like COVID. So at some point, we're all going to have to get out into the real world, and we have to make sure our immune system is really working at the optimal, at the highest level. And we have to make sure if another pandemic hits or we're older now, that we are still healthy. So that's why I just really want to emphasize the sugar thing. Number 2, this is my second tip. And again, it leads back to the sugar, but you need to identify all the hidden sugars that are out there. You will be so amazed when I tell you there are 56 different names for sugar, and probably even more. And these are hidden sugars that are in our highly processed foods. And remember, the highly processed food industry is a $2 trillion industry. So they're like working at it. They're like gonna get you addicted to this stuff. So here's a list. There's a picture of, I've put up a picture here of all the different kinds of names that we have for sugar. So the most common names for sugar, so we have the basic simple sugars like dextrose, fructose, glucose, lactose, maltose, sucrose. And then you've got the solid granulated sugars, which are like beet sugar, brown sugar, cane sugar, coconut sugar, dextrin, golden syrup. I mean, there is just a list here. So again, now you have to identify by reading your food labels where all these hidden sugars. It's kind of like an Easter hunt. You just got to find out, do a bit of discovery. Now that brings me to number 3. Number 3 is flossing and brushing. Yes, there is no excuse for no flossing anymore. You do have time. So let me give you a little tip for flossing, by the way. In your bathroom, if you just put your floss container there and then an empty plastic cup, and when you're showering, which you do every single day, I hope, you're kind of flossing, you can just put the dirty floss in a container, and then after that container gets a little bit full, you can just throw that the floss out or the cup out. So you can, if you combine it with like a process like showering, then you kind of put soap up and then do your flossing, and then you're more likely to do it. But why is brushing and flossing really important? Brushing is really important because that bacteria that eats the sugar that creates the acid is in between your teeth. So that's the only way you can get it, is by flossing and going all the way down into the gum line and up. And if you get bleeding, it's not necessarily, oh my gosh, you're going to bleed to death or anything. What bleeding is, it's kind of showing you that your gums are a little bit unhealthy, and they do need probably a good professional cleaning, which we'll do once the office opens up. The other thing that we have to do is be brushing at least twice a day. It's very important to be brushing twice a day because the brushing covers all the other surfaces of the teeth, the top, the sides, and the back. And that's the only way we get rid of the plaque that's on your tooth. And plaque forms by the bacteria eating the sugar, and that causes that white film on your teeth. The only way of getting rid of that is by brushing and flossing. And so that's one of the other things. And your last thing, your tip number 4, is to make sure that if you do have a problem, you reach out to us. Why is it important to reach out? Is so that we can identify if it's a problem and if it needs immediate attention or if it's something that can wait. And we are offering telemedicine appointments, which means that you don't have to come in for an appointment. You can just have a conversation over video. So if you want that kind of appointment, just call us on 510-793-8515. That's 510-793-8515. Or go to the website and fill out the quick contact form, which is www.yourcaringdentist.com. And then we can kind of figure out if you need to come in. And if you do need to come in, don't worry, we are open, but we're taking just severe emergencies per ADA, CDA, and CDC guidelines. And we have very strict new protocols in place to make sure that you are safe. So do not worry if you do have to come in. But the best thing to do is communicate with us first, and then we can determine if that is necessary. So hopefully this video was useful, and I'm going to be doing a lot more of these videos just to really kind of make sure that you're living as healthier and happy and vibrant life as possible. And if this was useful, please subscribe to my YouTube channel and share it with your friends. And I look forward to being in touch, and my next video will come out soon. I will see you then. Bye.